Hi, I'm Dr. Erin Michos. I'm a cardiologist at Johns Hopkins Medicine. I'm our Associate Director of Preventive Cardiology, and I'm our Director of our Women's Cardiovascular Health Program. So why am I passionate about being a preventive cardiologist? Well, we think that cardiovascular disease, and by that I mean heart disease and stroke, about 80% of it is thought to be preventable through treatable risk factors. A healthy lifestyle, such as a healthy diet, physical activity, not smoking, remains the foundation for prevention, but all adults should have traditional risk factors screened for, such as blood pressure, cholesterol, blood glucose, assess the family history. And so I enjoy working with patients to understand their individual risks for cardiovascular disease. And sometimes we have to get some additional blood tests or even a CT scan with a coronary artery calcium score to help refine their risks so that we can come up with the best preventive treatment plan just for them. I'm also excited about our Women's Cardiovascular Health Program. Among women patients, cardiovascular disease is under-screened for, underdiagnosed, and undertreated, and this can lead to worse outcomes in certain situations for women patients. All women should have their traditional risk factors measured for cardiovascular disease. In addition, there are unique risk factors unique to women that should be assessed for. It is my mission working with the medical and scientific community through my efforts in clinical care, research, teaching, education, and advocacy to help improve outcomes for our women patients. My research focuses on preventive cardiology and cardiovascular epidemiology. And by that means that I evaluate both traditional and non-traditional risk factors for cardiovascular disease in populations with the hope that these can be intervened on. Lastly, my research is focused on gender disparities in patient-reported outcomes with their healthcare experience. We studied a large national survey that was nationally representative of the U.S. population. This included 23 million adults who were living with cardiovascular disease in the United States. 11 million of them were women. And we found that 1 out of 4 women reported dissatisfaction with their healthcare experience in this national survey. And compared to men, women patients were more likely to report that they had poor communication with their healthcare providers, that they were more likely to feel that their doctors didn't listen to them or didn't respect them. And we also examined objective data. These were all individuals that had known cardiovascular disease, and we looked at medications of aspirins and statins, which should be indicated in this population. And we found that women were less likely to be prescribed these medications in this national survey. In other words, women were getting suboptimal care, and they felt this way too. As I mentioned, that my work has highlighted gender disparities and that women were more likely to feel that their doctors were not listening to them. And so I think it's important that we listen to all of our patients, particularly listen to women. And I want to work with you to come up with the best preventative plan that is right for you.